Welcome back. This is part 11 of things that your vet staff wishes that you knew, and now I'm going to begin covering what is considered an emergency. And I do want to break this up into 3 different parts. The very first one I'm going to do right now is going to be general emergencies that are true for both cats and dogs, but I will break it up into species-specific emergencies because I want to do everything justice. A lot of the things that are considered emergencies for both cats and dogs will be relatively obvious. And by that, I mean if your pet is collapsed, they're lateral, they are not responding to you, that is an emergency and you need to go see someone right now. If your pet is bleeding out because they've been hit by a car or they have a severe laceration, that's an emergency, you need to go see someone right now. If the gum color, and I do mean like your gums, if the gum color has changed at all, if it's pale, if it's blue, if it's white, if it's really red, that is an emergency. You need to go see someone right now. While a single seizure by itself that lasted less than 5 minutes may not be necessarily rushed to an ER, I want you to take that very lightly, because even just one is enough to at the very least go to urgent care or your general practice to get checked out afterwards. But if they are continuous or they are lasting more than 5 minutes, that's an emergency. You need to go see someone right now. If your pet has stopped breathing or is struggling to breathe in any way, that is considered an emergency. So with breathing, sometimes to see, as long as they have not completely stopped breathing, sometimes to see if they are getting enough oxygen, you can check the gum color, like I just mentioned. And if it's pale, it's blue, it's white, things along those lines, it's a pretty good indicator that your pet is not getting enough oxygen, and that is an emergency. With cats, you will see open mouth breathing, not so much in dogs. You might see more of the abdominal effort or stretching neck out and things along those lines. But if they are struggling to breathe or have stopped in any way, you need to go see someone right now. If your pet has been in contact with or ingested a known toxin, you need to go see someone. That is considered an emergency. With toxins, you might, depending on what they ingested, you might be able to go to urgent care or your general practice and just throw it up, but that is not always the case. Sometimes they may even have you call pet poison control and go from there. I'm not saying any of this to terrify you or to make you an anxious pet owner, but understanding what to look for and knowing what is considered an emergency can cut down on that time from the time that it happens to your pet getting help, and therefore increasing their chances of making it through an emergency like this. I know this one was a lot more serious than everything else I've covered so far, but let me know if you have any questions or suggestions for what else you want me to cover. Love you guys, bye. Welcome back. This is part 12 of things that your vet staff wishes that you knew, and this time I'm going to cover cat-specific emergencies. So that last video I just did covered things that were true for both cats and dogs, but this whole video will just be cat-specific emergencies. It is important to know that everything I mentioned in the last video is also true for your cat. You should be aware of those. The first one I want to cover is a urinary blockage, because the signs can be easy to miss if you're not paying attention. This is an emergency in any cat, although you will more often than not see it in a male, because their urethra is very long and narrow, where the female's is wider and shorter. They're not as likely to get blocked as a male cat is. The very first thing you're going to look for is my cat urinating? Has my cat peed sometime today? And if the answer is no, and it's paired with things like frequent trips to the litter boxes, straining and crying whenever it happens, or they're starting to act lethargic and weak and they just don't seem like themselves, that is an emergency room visit and you need to go see someone right now. I did touch on this in the general emergencies video, but if your cat is open mouth breathing, that is always considered an emergency in a cat. They are struggling to breathe and they need to go see someone right now. The next emergency I want you to be aware of is a saddle thrombus, or basically a blood clot that has blocked off the flow of blood to the hind limbs of your cat. If this happens, you will see sudden hind limb paralysis. Your cat will not be able to use their back legs and they will be in a lot of pain. If this happens, it is an emergency. You need to go see someone right now. The next emergency I want to cover is a GI obstruction, meaning that something has been ingested that is blocking up the intestines or somewhere along the GI tract, and your cat can no longer pass food through. one of the first things you would look for is vomiting or attempting to vomit and nothing is coming up. And it will get to a point where they can't keep anything down at all. String or yarn, ribbon, things along those lines are one of the most common causes of GI obstructions in cats. And if you happen to see an end of it hanging out either their mouth or their hind end, do not pull it. You can make things far worse by doing that. I did already touch on toxin ingestion in the general emergencies video, but for this one for cats, I want to mention one thing because I feel like not enough people know it. Lilies, the flower, are extremely toxic to cats. Even just pollen on the fur is enough to be concerned, and you need to go see someone if this happens. This video does not cover every possible emergency in a cat, so if you're concerned, call your vet and talk to them or go see somebody. It's not worth waiting. Cats are too good at hiding things until it's too late. Let me know if you guys have any questions or suggestions on what else you want me to cover, but love you guys, bye. Welcome back. This is part 13 of things that your vet staff wishes that you knew, and this time I'm covering dog-specific emergencies. So everything I mentioned back in part 11 for the general emergencies video is still true. Those are still emergencies. You still need to go see someone, but I'm going to go into a bit more detail here for things that we more often than not will see in just dogs. The first one I'm going to talk about is a GDV, or a gastric dilatation volvulus. Basically, the stomach has flipped. When this happens, your dog's stomach will start to fill with gas and food and twist off, cutting off the blood circulation to the rest of the GI tract. And it is very serious when it does happen. It's more common in larger breed dogs or barrel-chested dogs, but not impossible for other breeds. Signs of this happening will be a very distended and painful stomach. It can be vomiting and nothing is coming up, or even as severe as collapse. The next emergency I'm going to talk about is a heat stroke. So dogs have this habit of not knowing when to stop sometimes. They do not know when to chill out. And if it's really hot outside and they are playing really excessively, this becomes a concern. When it does happen, you're going to see things like excessive panting, or vomiting and diarrhea, or sudden collapse, or extremely bright red gums. And if you see any of that, it is not worth waiting. You need to go see someone right now. The next emergency I want to mention is a foreign body obstruction. So dogs like to eat things they're not supposed to. And when that thing can block off a GI tract, things like socks, underwear, tampons, or rocks, it becomes a real issue. If you have any concern that your dog has eaten something that could obstruct them, I would just tell you to go to urgent care or your general practice if they can get you in that day and have them vomit it up before it becomes an issue. Sometimes that's not an option, sometimes you didn't see it happen, that's when you need to go to an ER. As I mentioned before, dogs like to eat things they're not supposed to. So, toxin ingestion. I did touch on this in the general emergencies video, but I want to mention one specific one that I feel like not enough people know. Xylitol, the artificial sweetener. If it's sugar-free gum or something along those lines, that is very serious. They either need to go throw it up immediately or they need to be taken to urgent care or an ER. This is not every possible dog-specific emergency. That would be almost impossible, I think, to fit into one video. But they're things that you should be aware of and should act fairly quickly if you see them happen, or if you're just concerned, call your vet, see what they advise you. If you guys have any questions or suggestions for other things you want me to cover, drop them down below. Love you guys, bye. Welcome back. This is part 14 of things that your vet staff wishes that you knew, and this time we're going to talk about weight. And I know that this can be an uncomfortable topic, or you might feel bad about it, but it does need to be talked about, and I want you to know you're not alone. A lot of your vet staff is probably also struggling with the same issue, me included. I do have a chunky little dachshund myself, so I get it. It's hard, all right? But let's talk about it. So how do we determine if they are overweight, if not everything is breed-based, if we have to genuinely just look at the pet's body and determine if they are overweight or not? We use something called the body condition score. It goes from 1 to 9, 1 being severely emaciated, very underweight, and 9 being extremely obese. A 4 to 5 would be an ideal body score. For dogs, this can be done a little bit more visually than a cat. So a dog, you should be able to see the last few ribs, or at least feel them without having to press inward to get through a fat pad. And they should also have a little tuck under
like right behind the last ribs, and before the hind legs, their belly should just kind of, you know, tuck up. For cats, especially long hair cats, that can be a little deceiving. We have to actually palpate and see how easy the ribs are felt. And we don't really look for an obvious tuck like we do in a dog, because a cat is likely to have a primordial pouch, and that's normal. That doesn't mean overweight necessarily. The reason I chose this topic to talk about is because it's not just being a little thick. It's not just being a little bit overweight. It's a heavy strain on their whole body, and it can cause or put them at risk for multiple different issues. Primarily arthritis. It's hard on their joints. In my case, for a dachshund, that makes them more prone to IBDD. For cats specifically, I mean, this can happen in dogs too, don't get me wrong. We hear about diabetes in cats and dogs, but cats specifically are really at risk for diabetes. Another thing you may not think about in severely obese cats specifically is grooming, because they do groom themselves until they're too big and can't. And I can't tell you how many overweight, diabetic cats we have had to completely shave down bald because they're covered in matted hair. I'll say it again, I am right there in the trenches with you. But love is not giving them every treat that they want. Love is making sure that they live the best healthy lives that they can. One quick note before I go, being underweight is also a problem, but we see more overweight, and that's why I wanted to include it in this video. But let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 15 of things that your vet staff wishes that you knew, and this time we're going to talk about dental disease and why your vet might be suggesting a dental for your kiddo. Let me start by saying it is not just for the money. It is not just to charge you an arm and a leg for anesthesia and to clean your dog's teeth. There's legit medical reasons why we might be suggesting this. One of the more common questions we get about this is, why does my pet need to be under anesthesia to get a dental cleaning? It's because they're not going to tolerate it well. It is essentially the same thing that your dentist would do to your teeth for a cleaning, and we know better. We still find that uncomfortable, but we know better. We're able to sit there and hold our mouths open. A dog or a cat is not going to do that. They're not going to understand why we have these weird tools in their mouths. Another thing you might be wondering is, why does my dog need a dental when if they were in the wild, they would be doing just fine? A couple reasons for that. One, our pets are domesticated. They are eating kibble and soft foods. They are not getting as much of that tartar and plaque scraped off as a wild animal probably would. And another thing, they are probably still suffering. They just don't have access to care. They can still break a tooth. They can still have dental disease. Like, they're not immune to it. They're just not getting care for it. You can do things at home to help, like brushing their teeth or using some of the VOHC approved products on your pet's teeth can help reduce how many times you actually have to get them a dental. We technically recommend it yearly, just like you would go see your dentist at least yearly, but it doesn't always happen. There are things you can do to help at home as well. I think it's important to mention that dental disease can be progressive, meaning that after a certain point, it's not going to get better on its own. It needs professional care or sometimes full extractions of the teeth. Now, this is not the only health concern you have to worry about with periodontal disease, but I do want to mention it just because I did a research paper on it for humans when I was still in college. So, chronic periodontal disease is essentially an infection in the teeth. And when that progresses to a point that it can get into the bloodstream, it can make it to the heart, and it can cause, if not contribute, to infective endocarditis. One of the last things I'll mention for this is that the signs that your pet is experiencing pain from this can be subtle. So if your vet is telling you, hey, their teeth look bad, they could really benefit from a dental, they are trying to warn you before your pet gets to a point where they stop eating because of the pain. My 3 minutes is approaching, but let me know if you guys have any questions or suggestions for what else you want me to cover. Love you guys, bye.
Welcome back. This is part 16 of things that your vet staff wishes that you knew, and this time we're going to start covering toxins. I am going to have to break this up into a few videos, so this very first one is just going to cover food that you cannot share with your pets. The first one I'm going to talk about is going to feel kind of obvious. Chocolate. Chocolate is very toxic to both cats and dogs, and that's primarily due to theobromine content, but caffeine plays a role as well. I do want to add that the type and amount of chocolate ingested does matter. Although I'm not telling you to give your pet chocolate, milk chocolate is less dangerous than dark chocolate due to the theobromine content. Signs after ingestion can look like vomiting, diarrhea, tremors, seizures, increased heart rate, and arrhythmias. The next toxin I'm going to talk about is grapes and raisins. So this is very well documented in dogs that it does cause acute kidney failure. There is not as much evidence and documentation of cats, but be on the safe side, assume that it's toxic to both. I want you to take this part lightly. Raisins are more dangerous than grapes, but that does not mean that you can give your pet a grape. There is no safe dose. Do not give it to them. Some of the signs that your pet may have ingested this would look like vomiting, lethargy, loss of appetite, but particularly increased thirst but decreased urination. That is telling you that their kidneys are shutting down. The next toxin I'm going to talk about is more of a group of toxins called alliums, including chives, onions, and garlic. I will mention that cats are more sensitive to this than dogs are, although it's toxic to both of them. Just because it's cooked or powdered does not mean it's less dangerous. It still poses enough risk that it's not worth it. It causes oxidative damage to red blood cells, leading to hemolytic anemia. So let me put that in English for you. Basically, it is causing damage to the red blood cells faster than the body can reproduce them, to a point that the body can no longer circulate oxygen the way that it's supposed to. Signs that your pet ingested this could look like vomiting, diarrhea, lethargy, pale gums because that oxygen is not circulating like it's supposed to, weakness, increased heart rate, or even collapse in severe cases. The last one I'll mention for this video is xylitol, which is an artificial sweetener found in many sugar-free things like gum and candy. This is another one that's more well documented in dogs than it is in cats, so it's just better to assume it's toxic to both. But it is known to cause a massive insulin spike to the point of hypoglycemia or low blood sugar. It would cause vomiting, weakness, seizures, tremors, collapse, and sometimes even liver failure. Coming up on my 3 minutes, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 17 of things that your vet staff wishes that you knew, and we are still covering toxins right now, and this video is going to cover medications that your pet cannot have. I do feel like this is a very important toxin discussion because there are so many drugs that serve dual purpose for both humans and pets, like fluoxetine, frequently given to both humans and pets. But these are not safe. You cannot give your pet every medication that we are able to take. The first drugs I'm going to talk about are NSAIDs, or non-steroidal anti-inflammatory drugs. That would include things like Aleve or ibuprofen. Ibuprofen is the same thing as Advil. If you did not know, Advil is the brand name, ibuprofen is the drug name. If your pet were to ingest these, you would see things like vomiting, diarrhea, stomach ulcers, GI bleeding, black tarry stool, sometimes even in severe cases, seizures and kidney failure. The next drug I want to mention is Tylenol or acetaminophen. That is the same drug, same whole situation as Advil, where Tylenol is the brand name, acetaminophen is the drug name. And I want to bring this up because I see this issue far too often. Advil and Tylenol are not the same thing in any way, shape, or form. Yes, they both provide pain relief, but they do it in different mechanisms. Tylenol is not an NSAID. It's worth mentioning that this would be more serious in a cat than it would a dog. It is toxic to both of them. It is not worth it. Do not give them Tylenol, but it is more serious in cats. If a cat were to ingest this, it might look like facial and paw swelling, brown or blue gums, difficulty breathing, and eventually liver failure. For dogs, it might look more like vomiting, lethargy, and then eventually liver failure, and you might be noticing that I've said that twice now, liver failure being a symptom of this, and that's because Tylenol is metabolized in the liver. That's true for no matter what organism ingested. The next drugs I'm going to mention are ADHD or stimulant drugs, including things like Adderall, Vinase, and Ritalin. These are central nervous system stimulants, so most of the symptoms are going to be neurological, such as extreme hyperactivity, pacing, agitation, increased heart rate, fever, tremors, panting, and sometimes seizures.
The last one I'm going to talk about is melatonin. So this is a little nuanced because there could be situations where your vet might recommend this in a small dose, but keyword being small dose. Some of those come in a gummy form, and if they're sugar-free, there's the chance that xylitol, the artificial sweetener that I covered in the last video, could be added in there. Then you're not just dealing with melatonin overdose, you're also dealing with xylitol. Once ingested, it might look like extreme sedation, wobbliness, disorientation, vomiting, and sometimes paradoxical agitation. That's all I have time for on this one, so let me know if you have any questions or suggestions. Love you guys, bye. Welcome back. This is part 18 of things that your vet staff wishes that you knew, and we are still covering toxins right now. This video will cover household and chemical toxins. The first toxins I'm going to talk about are cleaning products. So it doesn't matter if it's a stovetop cleaner, if it's a toilet bowl cleaner, if it's bleach, all of those are going to be toxic to your pet. If they were to ingest this, you might see things like pawing at their face, painful swallowing, vomiting, drooling, and often chemical burns to the mouth and esophagus as well. If these things are toxic even to us, to a point that sometimes we can't even touch them barehanded, we have to wear gloves, I'm sure you can imagine just how bad it can get depending on what exactly they ingested. The next toxin I'm going to talk about is antifreeze or engine coolant, and the chemical compound in that usually causes the most issues is ethylene glycol. Antifreeze tends to have a very sweet taste to it, so it will entice your pet to lick it up, and even tiny amounts are extremely toxic to them. It will cause severe kidney failure within 24 to 72 hours if you don't get help very soon. Early signs of ingestion would look like being a little drunk or wobbly, being lethargic, and vomiting. But usually once you see any signs, you are racing against the clock to prevent that kidney failure. Another worthy mention are rodenticides, or rat and mouse poison. If your pet were to ingest some of this, the signs might look like pale gums, weakness, bruising, seizures, but in severe cases, internal bleeding and organ failure. The next toxins I'm going to mention are essential oils and diffusers. This doesn't mean you can't ever have essential oils in your house, but it does mean you need to be careful about it. The severity of it would depend on factors like the type of oil ingested, the concentration of the oil ingested, how much was ingested, and the size of the animal. If a dog were to ingest this, more often than not, the signs we're going to see are going to be GI related, but that does depend on what oil they ingested. So things like vomiting, diarrhea, drooling, and lip licking. There are certain oils such as tea tree or eucalyptus that can affect the central nervous system. And in those cases, you might see more of like the wobbly and drunk, lethargy, weakness, tremors, and sometimes seizures. This is typically going to be more serious in a cat than in a dog, and that is because cats are lacking a specific liver enzyme that would allow them to process these oils. Some things you would see in cats would be some vomiting, lethargy, drooling, tremors, and eventually liver damage. I'm running out of time on this one, so if you have any questions or suggestions, drop them down below. Love you guys, bye. Welcome back. This is part 19 of things that your vet staff wishes that you knew. We are still covering toxins right now, and this video will cover outdoor and plant toxins. The first toxin I want to talk about is a lily, the flower. I have touched on this in a few of my other videos, talking about how this is an emergency in cats. It is extremely serious. Even just a tiny amount on the fur is enough to be concerned about kidney failure. For the purpose of this video, I do want to mention that they are technically still toxic to dogs too, just nowhere near as serious. In a dog, it will probably look like GI upset, things like vomiting, drooling, and diarrhea. Lily toxicity in general refers to true lilies, such as an Easter lily or a tiger lily. And just because it's not a true lily does not mean it's safe either. An honorable mention would be lily of the valley. That is not a true lily, but it is still very toxic. It will cause heart problems in both cats and dogs. The next toxin I want to talk about is our lovely friend THC. The severity of this is massively going to depend on the size of your pet, how much they ingested, and the concentration of what they ingested. While typically ingesting it would be more serious, we do also have to worry about smoke inhalation. So if you are blowing it in their face or smoking in a really enclosed room that's not well ventilated, you would still have to worry about this. Dogs will be more sensitive to this than cats would be, and that is because they have more of the CB1 receptors that actually bind to the THC in their brain, specifically in the cerebellum or the balance and coordination center of the brain. The most dangerous forms that they could get into would be like a concentrate wax that you would smoke or an edible. With an edible, you may also have to be concerned about what it was made with. If there is chocolate, if there is xylitol, if there's raisins, that is an extra concern on top of the THC toxicity. Most of the signs that your pet ingested this are going to look neurological. So they're going to look a little wobbly or drunk. They might not be able to hold their bladder like they normally would be able to. They might be dribbling urine all over the house. They might be a little agitated in some cases. I want to clear up a misconception. You can overdose on THC. It is very hard to do in humans. It takes many edibles to do it, and rarely you will ever see it with smoke inhalation. It is easier for it to happen to dogs and cats. It takes less amounts of it for it to happen to them. The last point I will make for this video: we are not the police. We do not care what it is that you keep in your home. We only care about what your pet ingested and how to best help them. Please tell them what your pet got into. That's all the time I have for this video. So if you have any questions or suggestions, drop them down below. Love you guys. Bye.
Welcome back. This is part 20 of things that your vet staff wishes that you knew. Now, this video might sound a little controversial, and I want you to know that I mean everything with love, but these are things that you are unintentionally doing that are driving us a little crazy. Number 1, not giving medication as prescribed. If we send you home with sedation medication like trazodone or gabapentin and tell you to give it before the next appointment, that is for the safety of everybody involved. That is for you, that is for your pet, that is for us. Please do not skip it because it makes them sleepy, because I guarantee you when they get to the vet and they're stressed, they're not going to be as sleepy. If you're prescribed specific medication for a medical condition, such as seizures, and you stop giving it because they're doing better, I physically want to rip all of my hair out. I love you to death, but it was being controlled by the medication. Number 2, yelling at and arguing with us about the price. We did not set that price. We have no control over the price. Most of us couldn't afford it either. Pets are expensive. You yelling at us and being disrespectful is not going to change the price or the outcome. It is just going to get you fired from the clinic. Number 3, telling us he's never done that before, or she would never bite, as your pet is actively trying to eat me. Your pet might be so sweet at home and might be great with strangers, but that doesn't mean you know how they're going to act when they are afraid and a bunch of strangers are poking and prodding them. Number 4, coming in for a wellness visit and then having some substantial and very serious medical concerns. I want to clarify, that does not mean that you can't bring up at your next wellness visit, hey, he has this little lump on his side, he doesn't seem bothered by it, can you check it out? That's fine. I am talking about things that completely change how this visit is going to go. For example, if you tell us that your pet has been having vomiting and diarrhea for 3 weeks, we're probably not doing vaccines today. This is now a sick visit, and we're not going to make any symptoms worse in the process. We're going to push that off until they're better. Number 5, refusing prevention because you live in a gated community. This one in particular does make my head hurt and really test my ability to hold that poker face. I promise you, fleas and ticks do not care that there is a gate there, not one bit. I will quickly mention that your cat that stays indoors 24/7 and never goes outside is also not immune. Fleas and ticks can hitch a ride on us. They can hang out on our clothing or our shoes, and then suddenly they're inside your house and can bite your pet. I'm coming up on 3 minutes, so that's all I'm going to cover in this video. But just know, we don't hate you. It just drives us a little nuts. Love you guys, bye.